Hi, everyone. On behalf of the Hastings Center, welcome to A Critical Moment in Bioethics, a webinar co-sponsored with the Hastings Center. It's now my pleasure to hand it over to the panelists and Jennifer McCurdy.
Good morning, and thank you, Danny. Thank you for the Hastings Center for hosting this event. And I'm Dr. Jennifer McCurdy, a postdoctoral fellow at the University of Alaska and co-chair alongside Dr. Faith Fletcher of the Race Affinity Group of ASBH. As a white person, I do not take lightly the privilege and trust I have been given learning from and working alongside my Black and Brown colleagues in these spaces. Having been witness to the phenomenal leadership of Dr. Faith Fletcher and the village it has taken to produce world-class scholarship, I am proud to introduce this panel discussion today. This session will describe an anti-racism initiative co-led by the Hastings Center and a diverse steering committee of justice-focused bioethics scholars. This collaborative initiative reflects on the past and present work of scholars of color and envisions and frames a braver, broader, and more just bioethics for the future. Through robust intergenerational dialogue and interdisciplinary collaboration, this project aims to strengthen bioethics ability and moral responsibility to address racial and health injustices. Intended to serve as a model for future anti-racism initiatives, this session will highlight engagement strategies to bolster inclusivity and equity in the field of bioethics. Let me introduce our panelists. Dr. Faith Fletcher is an assistant professor in the Center for Medical Ethics and Health Policy at Baylor College of Medicine, a senior advisor to the Hastings Center, and outgoing co-chair of the Race Affinity Group. Her empirical research over the past decade focuses on healthcare and research experiences of minoritized populations to inform ethically grounded and community-centered practices and strategies. Dr. Fletcher received training through Fordham University's HIV Research Ethics Training Institute and is a contributor to the American Public Health Association's new Code of Public Health Ethics. Dr. Keisha Ray received her PhD in philosophy from the University of Utah and is currently an assistant professor with the McGovern Center for Humanities and Ethics at the University of Texas Health Science Center in Houston. Most of Dr. Ray's work focuses on the social and cultural determinants of Black people's health, integrating race education into medical school curricula, and the ethics of biomedical enhancement. She is also the senior editor for American Journal of Bioethics blog site. Dr. Claretta Dupree is a registered nurse with a wide variety of clinical and academic experiences in both the civilian and military sectors. Dr. Dupree was previously an assistant professor at the Medical College of Wisconsin, where she was director of research of the Pediatric Palliative Care Department. She graduated in 1975 with a Bachelor of Science in Nursing from the University of Tennessee Center for the Health Sciences in Memphis. Her naval career began soon after with a direct commission, followed by Officers Indoctrination School at Newport, Rhode Island. Dr. Dupree earned a Master of Science in Oncology in Nursing from the University of Texas Health Science Center in Houston in 1985 and completed a Doctor of Philosophy degree in nursing with a minor in philosophy at the University of Wisconsin in May 1998. Currently retired, Dr. Dupree stays busy serving as an ethicist for the Data Safety Monitoring Board of the National Institute of Allergy and Infectious Diseases, the Asthma Allergy Section, crocheting, playing musical instruments, and studying essential oils to increase skills as the Miraphor. And Dr. Virginia Brown is an assistant professor at Dell Medical School in the Department of Population Health and a courtesy assistant professor in the Department of Psychiatry and Behavioral Sciences. She earned her master's degree in philosophy with a concentration in ethics and public policy, and her doctorate in sociology with concentrations in race, class, gender, and medical sociology. Dr. Brown's area of interest include the structural determinants of health, in other words, conditions in which people are born, grow, live, work, and age, and their influence on health and healthcare outcomes. Through the theoretical lens of historical materialism, she seeks to disrupt how the social and political structures contribute to the formation and reformation of racial bias in health and healthcare. So now I'm going to turn it over to Faith.
Okay, sorry, apparently I'm not able to unmute and also screen share. So I'll just start off by thanking Dr. Jenny McCurdy for that wonderful introduction of panelists. And also I want to thank Dr. Millie Solomon and colleagues at the Hastings Center for engaging in this collaboration with us. So now I'll screen share. Okay, so I'll begin this presentation by highlighting the Anti-Racism and Bioethics Initiative, and I'll hand it over to Dr. Keisha Ray, who will provide some examples of anti-Black racism and bioethics. Dr. Virginia Brown will talk about combating anti-Black racism through praxis, and Dr. Claretta Dupree will offer closing remarks and reflections based on her experience of decades in the field of bioethics. So we're so thankful to have Dr. Dupree here with us today. So I want to begin this presentation by centering, reflecting, and remembering the contributions of the late Dr. Marion Secundi. For those of you who may not have known Dr. Secundi, she was the first director of the National Center for Bioethics and Research in Healthcare at Tuskegee University. She also led early conversations focused on racial justice within the organization of ASBH, but in the field of bioethics broadly. Many of us know Dr. Secundi for her legacy of intergenerational mentorship, and I'll reflect on that because it's central to the work of bioethics and also key to this special report. So I'll center Dr. Claretta Dupree, who reflects on this legacy of intergenerational mentorship with her interactions and engagement with Dr. Marion Secundi. Dr. Dupree states, quote, "In 1997, there was a joint meeting of 3 organizations that would combine to create the American Society for Bioethics and Humanities. The handful of Black attendees included Dr. Marion Gray Secundi, who attended Claretta's panel presentation where she described her dissertation work. Her work then focused on the attitudes of Black Americans towards advanced directives. Claretta describes that it was her first time presenting at a bioethics conference, her first time presenting at a national meeting, and her first time meeting Dr. Secundi and other Black bioethicists. Claretta recounts that later in the meeting, a small group of scholars met to discuss the state of bioethics as it concerned Black people. During the personal introductions and scholarship, the group then decided that they needed to engage in a long-term collaboration and needed long-term and sustainable support. So they vowed to meet the following year at ASBH. By that meeting, ASBH had established a structure that required an application for formal affinity group status. Affectionately stated by Claretta, Dr. Secundi voluntold me to complete the application. Thankfully, Dr. Dupree accepted the charge. ASBH was approved by race and affinity group with Claretta as the first chairperson. So ASBH is still a venue for providing space to individuals, groups, and scholarly areas underrepresented in the field of bioethics. Even then, they voiced concerns about healthcare disparities, maltreatment of Blacks when accessing care, the prevalence of microaggressions, and racist behaviors experienced by Black professionals in academia. And this was in the late 90s. So I highlight this to say that Dr. Secundi was, of course, a friend, a colleague, a role model, and mentor, and a tie that binds many Black scholars working in bioethics. The intergenerational Black bioethics tradition continues more than 2 decades later. And as a collective, we are here and we still wrestle with issues of anti-Black racism in the field of bioethics, highlighting the critical need to reckon and focus on anti-Black racism. So again, some of those issues expressed in the late 90s raised by these scholars are still relevant today, such as racial justice, racial injustice, health as well as healthcare inequities, a general lack of respect and value for the lives, the lived experiences, the lived realities, and the moral dilemmas of Black people. Traditional bioethics networks have not served people of color. In fact, they continue to advantage some scholars while disadvantaging others. As a result, there's a need for continued safe spaces and structures for Black scholars to connect, to network, and to offer as well as to receive mentorship. And finally, there's still a need to center and amplify the voices and scholarship of Black scholars across generations. Out of this critical need, the Anti-Racism and Bioethics Initiative was born in collaboration with the Hastings Center. This is intended to represent a series of special reports, with the first report focusing on anti-Black racism and bioethics. We hope to see this in press in 2022. The first report is funded by the Greenwall Foundation, and we are continuing to seek funding for future reports. I want to highlight the project team, especially my colleague, Dr. Jenny McCurdy, for helping to execute this work. Many colleagues at the Hastings Center who remained available and accessible to us over the work. More importantly, they trusted us to lead this work and to carry out this critical vision. So thank you. Guest editors include Dr. Patrick Smith, Dr. Virginia Brown, Dr. Keisha Ray, and myself. I want to thank Dr. Patrick Smith, who's currently presenting in another session, for his early contributions to the special report and for his continued mentorship throughout the process. So we can't say enough about the support of the steering committee. I really refer to this as a co-led initiative. The special report was led in collaboration with steering members with diverse expertise. We established this committee about a year ago, and committee members, they were actively involved in all aspects and all phases of developing and executing this special report. This includes selecting the focus of anti-Black racism, identifying potential authors, reviewing and writing papers for some, making critical connections. We even had 2 leaders who met with Nora Porter, the art director at Hastings, because the committee really had an interest in making sure that the art on the cover art represented the theme appropriately for our vision based on our conversations. So very much involved in this work. And there were several members who actually conducted interviews of senior scholars in the field of bioethics, as well as community members, to make sure diverse voices were represented in the process. So we want to thank this committee for their time and talent. We know that this was a time where many scholars of color especially are juggling with a lot of demands and expectations from their institutions, but they willingly gave of their time, and they also provided assurance that this work was headed in the right direction. So thanks to all of you. So we'll talk briefly about the goal of the report. We will have future presentations that really highlight some of the details, but we wanted to give a general overview. Again, the goal was to really elevate the voices of established Black scholars, those who are emerging, and other scholars who have an interest in underrepresented issues in bioethics. Based on conversations with committee members, it was clear that we really needed to build upon the work of influential scholars by introducing the scholarship to a generation of new bioethicists. So we see thematically that there are a lot of references and books and sources that are cited throughout the report that we hope can be used for a teaching tool in the future and other bioethics initiatives. So we do this by, again, praxis engaging, citing Black scholars in our work, in our research. And one of the things that was especially important that we heard over and over from scholars is that in the past, Black scholars said that their work was considered to be too radical, too personal, their race and racism work, too ancillary to the work of bioethics. So again, we highlight this and center this in the report and thank them for their contributions. So the structure includes articles, essays that are based on racial justice, health and healthcare inequity, multiple types of articles, normative, empirical, as well as narrative. I mentioned that we interviewed people because we want to make sure that we include different types of documentation and different ways of collecting information and telling stories. So that included these expert reflections. And finally, we ended with a tribute to Dr. Marion Gray Secundi from several scholars, as well as other people who consider to be friends of Dr. Secundi and who have had engagement in the field of bioethics over the years. So we've learned a lot of lessons, and we'll talk a little bit about that in our discussion, but I want to highlight a few here. I'll start off by saying engaged scholarship takes time. So we didn't want to develop a report using a top-down approach. We definitely were interested in making sure that the thoughts, perceptions, and ideas about this report were represented from a diverse and a collective. And again, this means that there has to be adequate time for planning, adequate time for meetings. We met at least 7 to 8 times over the course of a year, again, during a time that was really demanding, especially for Black scholars and other scholars of color. We have to be open to new ways of doing things, different ways of writing, different ways of reviewing, different ways of approaching the editorial process that may even include having conversations with, giving advice orally, as well as giving written feedback for editorial. So we had a lot of calls with scholars who were interested in more feedback. And this actually, we believe helped to strengthen the process and to create structures that are more equitable for engaging people in manuscript writing, et cetera. And finally, we really learned that, and we knew this, but solidarity is central to anti-racism work. So non-Black scholars really stood behind the idea, given the climate, that we should really be focusing on anti-Black racism and bioethics versus a broader focus on anti-racism. So again, this was critical, key, and we appreciate our colleagues and allies who really supported and stood behind this work. So I'll end my presentation by reflecting on the current state of anti-Black racism and bioethics. So here we are in 2021. There's a national push to recruit Black bioethicists for faculty positions, for lectures, for panels, for media contributions. And the question has frequently arisen. I've heard it in meetings and working groups, in conversations with other people. Where are all the Black bioethicists? So I want to highlight this tweet. This is a nod to Dr. Holly Fernandez, who developed a resource to those looking for Black bioethicists, as well as Joanne Suarez, who's the special report contributor, as well as founder of the Latinx Affinity Group. So she really helped to expand this resource guide to include Latinx scholars of color. So I want to just leave this here for a second, because this will really help to even generate more conversation around this when we get to the discussion section. So the question, where are all the Black bioethicists, sorely needs reframing. Instead, one should ask, what are the embedded and existing structures and systems that continue to exclude the work of Black bioethicists from mainstream bioethics? What are the institutions and organizations doing to develop a pipeline in infrastructure to train, nurture, and support the next generation of Black bioethicists? And finally, what are you doing within your own institutions and organizations to make the climate and structure more equitable, more just, and more inclusive for Black scholars and other scholars of color? I'll leave this here. Alice Walker states, "We will be really misled if we think we can change society without changing ourselves. In order to transform the field of bioethics and to reimagine a field that is better, bolder, braver, and more just, we must first change ourselves." Thank you for listening.
Okay, hello everyone. So I'm going to briefly act as a segue between what Dr. Fletcher said, and I also wanted to say something. I know that there are multiple people who have been taking the lead on this project, but Dr. Faith Fletcher is the lead editor, and she has downplayed her enrollment. This would absolutely not be possible without Dr. Fletcher. So she is one of the editors, but she is the lead editor, and let's be clear on that. So I'm going to act as a segue between what Dr. Fletcher said and what Dr. Brown and Dr. Dupree will say next. So mine will be brief in nature. So I want to talk about just what is anti-Blackness in bioethics. Sorry about that. I want to tell you all just what it means to talk about anti-Blackness in bioethics and to really think about why it's important to recognize it. And I think that I gathered this list a lot from my own experiences with anti-Blackness and bioethics, but also talking to other colleagues. So when you see something listed, just note that this is not something that we just pulled out of thin air. This is something from people's actual experience, from Black bioethicists' experiences. But I think it's important to talk about just what anti-Blackness is in bioethics, because if you don't know what it is, you can't call it out. You can't say it by name. And if you can't say it by name, you can't correct it. And so we have committees that are dedicated to anti-Blackness. We have DI committees. We have a lot of them arose during the summer after the murder of Mr. George Floyd. So schools have been sort of doing this performative anti-Blackness committees and things like that, but without really doing the work of what it really is. Those kinds of initiatives at institutions cannot really do the work that they want to do. We also have to identify for things like solidarity and allyship. And then again, this is something that Black bioethicists experience, and that we can spot it when it happens to us, or when we're sharing our stories and we can say that seems a little suspicious, you know, when we're all in our private spaces and those trusted spaces with one another. But I think it's important to call it out and call a spade a spade. So again, this is not an exhaustive list, and this is just some of my examples. Hopefully during the Q&A, we can talk about more concrete examples. And again, I know Dr. Brown and Dr. Dupree will talk about these in more detail. So in practice, thinking about hiring practices, I've been in hiring situations, the behind the scenes, and I see some of the tactics that are used to make sure that people of color, particularly Black scholars, are not hired. Things like elitism for institutions, also things like changing the goalposts. You see those kinds of things happening. Not including Black scholars on funding opportunities and grant proposals, especially when they get the email that says, hey, can I pick your brain for this scholarship? I mean, for this opportunity or this grant proposal, but don't actually put them on it, right? And so they don't get the benefits, the career benefits of those funding opportunities. I mean, teaching, when we don't teach Black scholarship, when we don't teach varied topics in our bioethics courses, when we don't talk about how topics that we discuss in our courses differently affect and influence Black people's lives. So for instance, talking about scarce resources and resource allocation, that's really something that is common to a lot of particularly undergraduate bioethics courses. But when you don't talk about how those things influence other groups, that becomes a problem. That becomes another instance of anti-Blackness. Another time that we can see anti-Blackness in our teaching is when we talk about race. I hear this a lot from my medical students and their other core curriculum courses, and they'll say how their instructors talk a lot about race as being a factor for different disparities or for different medications or different things like that. But they don't talk a lot about racism as a driver of differential health outcomes. So when we talk a lot about race, but don't talk about the experience of Blackness, the experience of Black people, particularly in America, and their experience of racism, that becomes anti-Black practices in our teaching. Next, when we talk about publishing and invited lectures, not inviting Black scholars to our institutions to give talks and to give lectures, or when we invite non-Black scholars to speak on topics that Black scholars have extensively published on, that again is also an instance of anti-Blackness in our scholarship. This is something too, it's very personal to me, it's happened to me many times, but thinking about how we pay Black scholars versus other scholars, and when it's less than other scholars for doing the same amount of work. Only inviting Black scholars to present on Black topics, because you know we study a lot of different kinds of topics in bioethics. Not publishing articles on racism as a social determinant of health. I know that there have been other Black scholars who have called out very top journals and have done the research to show that whenever race is mentioned in these journals, there's no mention of racism, and that a lot of journals in our field in public health and in bioethics have a very poor record of accepting articles where racism is at the forefront. When we don't include Black co-authors, when we absolutely should, when it's about topics that they are well known in and topics that they can contribute to. In our profession, not asking scholars to be a part of national committees. right? And asking them to do, to not be a part of them, but then asking them to do work, perhaps denying Black scholars access to leadership roles. So this is a little bit different than the prior one, because many times Black scholars will be asked to be committee members and sometimes doing a lot of work for these committees, but not given access to be a leader and given the trust to lead these committees. And then again, they don't get the benefits to their career. And when they're doing a lot of work, that also sidetracks their tenure goals and that kind of thing. And then creating a hostile environment at conferences and departments. This is something that, again, I have personally experienced at different conferences, but you can create an atmosphere that makes it very clear that Black bioethicists are not welcome here. Their work is not respected and not welcomed. And then I know Black bioethics, this is something that I practice in the way that I do. I know that there are other people who think differently about Black bioethics. There are other people and there are entire books on African American bioethics. This is just an instance of how I think about it in my work. I think about it as a lens of racial justice. So it's a question that I think these kinds of questions here I think about, I try to keep at the forefront of my mind when I am practicing bioethics, when I'm teaching bioethics, when I'm writing about it, or even if I'm reading some other people's work, I try to look at it through a lens of racial justice for Black people. So how it might fit here as a profession to think about some of these questions, like what does it mean to consider racism, anti-Blackness, and racial justice in bioethics? What does racial justice for Black scholars in bioethics look like? How do we implement change that benefits Black bioethicists? What are political, social, and cultural obstacles, real and imagined, to the success for Black bioethicists? And how can we protect the mental, emotional, and physical health of Black scholars? So maybe we can talk about these, and I will stop sharing my screen and turn it over.
Thank you very much. Let me bring a couple slides up and we'll get this third part of this conversation going. And so I get that little spinny thing. Come on, let's do our thing here. Here we go. So thank you to my colleagues and everyone who's been involved in doing this. This is part 3, and in part 3, I gave it a name. It might be familiar. What does bioethics owe justice? And I want to take you back for just a moment to this quote from King. This is the more authentic quote that has been rediscovered. Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death. This was from 1965 or 66. This is something that we have known and we continue to discuss, and it's October 2021, and we're still discussing it at the 23rd annual conference. What I wanted to do is ask a couple of questions and tell you that some of the things that I'm going to say, and this is not an error in my slides, this is a slide from 2019, where it was the 50th anniversary of the Hastings Center. And there I was asked to be on the plenary and respond to a conversation that Dr. Mary Bassett was our plenary and gave the keynote along with Millie Solomon as the moderator, and Marian Danis and myself offered remarks. And since that time in October of 2019, a lot of things have happened and many things have stayed the same. There's been a global pandemic, that's very clear. There was the death of George Floyd and this, what I call the societal performative response to Black Lives Matter by mainstream organizations, some profiting from the paraphernalia that was created, flags, banners, signs, these kinds of things. And let's be clear, I don't have a problem with getting your side hustle on, but I'm not really sure what was done foundationally to move from a performance of Black Lives Matter into the kind of change that this special edition and my colleagues and I are trying to put into action. We cannot do it by ourselves. I am reminded that we've had an election, and yes, we have a multiracial vice president, Kamala Harris, who identifies as a Black woman, who went to my alma mater as an undergrad. That's not performance, that is commitment. But even still, in light of that, we still see a shifting in society. We have seen how there was an attempted coup to topple the United States government. We have seen the challenge to Roe v. Wade, regardless of what your ideological position is on Roe v. Wade. For it to be done truly in the cover of night is an assault to our democracy. We've seen a rise in vaccination rejections as an assault to one's liberty, and an underlying thing of how much, an underlying theme of how much of this is the consequence of one's proximity to power. And when I use that word proximity to power, I want you to hear proximity to whiteness, to heterosexual maleness. What is your proximity to power? That's the underlying conversation. That is the theme that unites us in this work and trying to unpack and recreate a new way forward. So with that said, consider this a black box where we've sort of punched out some lights. And my job in the few minutes that remain are to remind you of some of the things that I said in 2019, some of the things that were said here about actual actions that you can do as individuals. You don't need a committee. You don't need your chief's or your department chair's permission. You can do these things on your own. Cite Black Scholars comes from the University of Texas at Austin, from my colleague, Christian Smith. She is the creator of Cite Black Scholars. You can take a look, follow that hashtag. You can find Kristen on the homepage at UT Austin and learn more about that work. But I think what's more important, or as important when we think about this, is the idea that there is no scarcity. There is no scarcity in the work. There is no scarcity in the number of hands that is going to take to make change. For us to approach the work of making a more inclusive and inviting bioethics is not the domain of Black scholars, nor their allies. It is the domain and the responsibility of all of us to join hands. And to be very clear in what Dr. Fletcher raised in her opening is that in order to change, we must first change ourselves. And we cannot be afraid of not knowing. We encourage our students to be fearless in coming into the classroom, to lean in to learning and to throw off past conceptions, to be able to be critical thinkers and hold on to two opposing ideas at the same time and not run out of the classroom with their hair on fire. We have to remember that in our scholarship. This may be uncomfortable. These are crucial conversations that have high stakes. Mistakes will be made, but it is the intention and the desire to do better that will help us go forward. So I want to ask us a couple things as I move towards the end of this part. And I want to ask us, what is it that is owed? Okay, how do we move from the phrase of, oh, being so resilient, you know, the Black community is so resilient. Well, in that resilience, you fail to thrive. You're always bouncing back from something. The ability to thrive is never yours. So it is not, while it's probably said, I'm sure, as a compliment, it is a hindrance to always having to thrive despite adversity. That is the key thing. The ability to create more inclusive spaces really begins with understanding one's own privilege. So I'm going to quote Kimberly Crenshaw here when asked to describe intersectionality, okay? Intersectionality is a lens through which you can see where power comes and collides, where it interlocks and intersects. It's not simply that there's a race problem, a gender problem here, a class or LGBTQ problem. Many times that framework erases what happens to people who are subject to all of these things. So when we think about what needs to be different, we've offered you some brief things here about how to go forth and be different, how to be a better ally. I want to leave you with something new to add to your praxis. And it's this: to understand your privilege. Okay. And remember, we talked about that privilege. I have privilege. Okay. I don't have a lot of power, but I have privilege as a Black woman at a major university who earned a PhD. I have a great deal of knowledge about the academic system. I know how to mentor young people who want to come to college, to work through that system, young people to stay in college, to make that next move. I have a certain kind of privilege. And in the roles that I have, I need to always remember what I have, but what is it in proximity to the dominant form of power? White, male, heterosexual. That is the thing that we are always moving towards and moving away from. And so in that, I challenge each of us to ask ourselves, when we are making decisions or in rooms where decisions are being made, huddling in the ICU, reviewing a patient, what have we overlooked, failed to ask when it comes to intersectionality regarding this person who is in front of us? If we can pause and ask ourselves, this decision that we are getting ready to put in place, how does it potentially impact, when we think about this proximity to power, what have we failed to recognize in making our recommendation? If we can do that, we can begin to have more honest and fruitful conversations. And I really think that that's critically important. So with that, I hand my comments off for Dr. Dupree. I'm handing you the baton to bring it home. Thank you. Oh, you're on mute.
Can you see my screen? Yes, no? Okay. Am I still muted? Okay. Okay, slideshow. Okay, is that okay? Okay, I wanted to just start off by saying, you know, when you're growing up and at some point you get to adulthood and your kids start mothering you, start telling you what to do. So I feel that way with baby Faith, Dr. Fletcher, because I watched her grow up from working on her bachelor's degree and now she's telling me what to do. So I thank you, Faith, for telling me what to do. I appreciate it. So I have no idea where we are with time. So yeah, y'all have to, you know, put your finger up if I'm going over. I just have a few comments. And I wanted to start off with some conference session quotes that I want everybody to just kind of ponder. I will read these for the sake of those who might be listening on their phone or whatever. A cluster of issues fraught with ethical dilemmas, pandemic ethics, distribution of scarce medical resources, personal autonomy and public health measures, stewardship ethics, justice questions, what do we owe the poor, compensation to agribusinesses and others. And then another one. There are general philosophical objections about the ethics of limiting a person's choices for their own good. Just as with mandatory helmet laws for motorcyclists, some libertarians charge that a government mandate requiring citizens to act in a way it deems to be in their best interest is an unacceptably paternalistic infringement of citizens' rights. Are these objections strong enough to prevent a public health measure that would surely save a significant number of lives? Our panelists will illustrate how different perspectives can help suggest collaborative resolutions for such a multidisciplinary policy question. Okay, and here's some more objectives. Demonstrate why research programs centered on social justice and health equity have been neglected in bioethics, and whether or how this limitation might be overcome. Understand and discuss the relationship between culture and bioethics, in particular African-American culture and bioethics. Be informed about the role of culture and ethics. And then this is a genuine concern in biomedical ethics, which makes decisions about life, death, suffering, procreation, and the uses of professional power. Thus, a serious dialogue between African-American, and Western perspectives in biomedical ethics is in order. A pandemic will generate a shortage of vaccines, antiviral drugs, and critical care ventilators and beds, necessitating some form of rationing. Trust, or the lack thereof, in healthcare is gaining increased attention due to widespread media coverage of medical errors and breach in research protocols and ethical misconduct. Distrust among disparate populations is an important variable when addressing health outcomes and factors that contribute to racial and ethnic disparities in health and healthcare. So just thinking, what is common about all of those? Well, I will tell you, all of those objectives and quotations were copied from the 2007 ASBH program book. At that conference, Harriet Washington gave the plenary address some historical notes on US medicine, race, and ethics. As you can see, not much has changed in 15 years. I picked those particular objectives and quotations because as I looked at the program book for this conference, there are many of them very similar, almost look like they used the same ones with a few words changed. So what has changed? Dr. Wilson yesterday talked about vulnerability and how that concept needs attention as decisions are being made. I've not really heard that term much during this pandemic, but the term that I really want to turn your attention to is essential. We've been hearing talk about essential workers. And when we say essential workers, we are talking about the people that basically keep society moving, right? Truck drivers who are moving goods to communities, bus drivers who are getting people to those jobs that keep society moving. Essential workers are those that are more exposed to the disease than non-essential workers. So basically, essential has become synonymous with expendable. When we say essential workers, we mean expendable. One of the first deaths to make the news, one of the first deaths from COVID-19 to make the news was of a Black man who was a bus driver. He had been healthy. This was before vaccine was available. He had to work and he was considered an essential worker and he was applauded and lauded for working. He was wearing a mask and he had hand sanitizer on the bus, but he had no power to enforce others to, number one, wear a mask, number two, not get on his bus if they were sick. And in their defense, they are also going to jobs where they are considered essential workers, where they don't have paid time off, or if they do take time off, they know that they're just losing salary. So he died. He got COVID and he died. He was unable to protect himself. Why is this important? Well, we know that those who are considered essential workers, those who are expendable, are more likely to be Black or brown people, people of color. Those are the people who don't have the option or the luxury of working from home to keep themselves or their family safe. So that again puts more of Black, Indigenous, people of color at higher risk of getting the disease and of dying from the disease. And what we have said in society by labeling them essential, read expendable, is that they are easily replaced. We can easily get another one. So what has changed? Well, our angst as Black people and people of color has changed. It has increased, as have the many threats to our daily lives and being. What else has changed? Well, when I was growing up, this may be a little known fact about me. So I went from the 1st grade to the 7th grade, I attended a one-room schoolhouse in which were grades 1 through 12. And we had an outhouse, but we had two. There was one for the girls and one for the boys. So we had 2 outhouses. So that has changed, and that definitely is good. Also, when I was growing up, we used to go visit my grandmother. My father's mother lived in a different state, and we would go see her. My father would drive us there. And on the way, if we had to urinate, my father would pull over and we'd get out the car and go in the bushes. Why? Because the bathrooms at the gas stations were for whites only. They had signs up said for whites only. So that has changed. So what else has changed? And are those changes enough? And I give those examples because there's a lot of rhetoric right now surrounding, all of that was a long time ago. And geez, I don't feel that old, but I remember these things. So like, really, what has changed? As ethicists, we have discussed, we have collaborated, we have theorized, we have educated, we have developed policies, and we still have not gotten to the crux, to the heart of the matter. Why? As guides, teachers, researchers, and experts on values, morals, and ethics and bioethics, we have failed dismally. Because the heart of the matter is, well, hearts. Dr. Wilson talked about structural injustices being the issue, and she's not wrong, but those structures are made up of individuals who are anti-Black. So changes have to start there. We have to stop discussing, and I saw this in the program booklet for this session, this meeting. We have to stop discussing why Black people distrust white medical professionals and start discussing why white medical professionals behave in untrustworthy manners. Quit trying to develop educational programs and research programs to get Black people and people of color to trust an unethical practitioner. The discussions target institutions, but institutions are not anti-Black. The interventions target policy changes, but policies are not inherently racist. Institutions have employees and leaders, CEOs, CFOs, vice presidents, presidents, and board members who are racist, who just as a matter of being are anti-Black. The best that can be said is that these people are racist by omission rather than by commission. That is, they are unaware of their own privilege, and they are unaware of the ways in which that privilege oppresses Black people and other people of color, Indigenous people, all people of color. And that brings to mind another term that Dr. Brown brought up, the intersectionality. Most people of color, most Black people, most people of color are a combination of identities, each of which is marginalized in our society. And each of those identities that intersect in one melanated body is lacking the privileges that are not even given a thought by white caregivers. So what has changed? Well, I have changed. I noticed that when I was selecting sessions this time, instead of selecting sessions that I thought I would learn from, that I thought would give me new information, I selected sessions based on, well, this won't trigger me. And I was glad to see Dr. Ray mention mental health for scholars of color, because I thought that was just me that was having issues. So if white people lack awareness of the privilege that they walk in 24/7, they can certainly not be expected to address intersectionality and all the different identities that are oppressed by white privilege. So what's the solution? I cannot give you a solution, and neither should I. This is a privileged people's problem, and privileged people have to use their imaginations, first of all, to get a vision of a life, of an existence in which you are equal to everyone, as opposed to being superior to everyone. You have to get a vision and have a conscious awareness of your privilege, so that in every encounter that you have with a person of color, that you are consciously aware of your privilege, and thus are consciously aware that they do not have that privilege. And then you can acknowledge the ways in which the lack of that privilege is affecting their care or access to care, or when they arrive for care, and all of that. I was thinking about a friend who just a couple of weeks ago went to the emergency room with some distressing respiratory symptoms, excuse me. They did a COVID test on her, it was negative. So they sent her home, but her symptoms were quite severe. She went back, they did another COVID test, still negative, so they sent her home again. On the third visit, she was progressively getting worse, they finally did appropriate diagnostics, and she had Legionnaire's pneumonia. Now, I'm not saying that they would have done appropriate diagnostics had she not been Black, but that definitely is a thought. When somebody shows up at the emergency room now, and we know because research is showing that people are not going who need to go, you know they need to be there. So my last word, think about your privilege.
Thank you, Dr. Dupree. Thank you for those reflecting remarks and closing remarks and everything you've done to mentorship all of us, and to really you're essential and instrumental to race and just providing a safe space. So thank you so much. Thank you all. Such a wonderful panel. And there are so many great questions coming into the chat box right now. I'll start with Joanne's question. My question to all of you is, can you share one lesson from your journey as a Black bioethicist and scholar? And if you had any advice to give to the next generation of bioethicists looking to engage in bioethics discourse, what would that be? So feel free to take one or two and offer brief remarks. And I'll begin with Dr. Ray.
That's a difficult question, Joanne, because summing it all up into one thing. One thing that I will say is, unlike some of the other people, unlike some of the other Black bioethicists, I didn't have Black mentors, not intentionally, just our paths didn't cross, right? No one's at fault. But I had great mentors in other people. But what has kept me going in my career when I'm experiencing microaggressions, or let's just call it racism, right? Or any of these other kinds of things, community, right? Finding my community of fellow Black bioethicists, that has really helped me. So find your community, find your people, find your group, find the people that you can confide in, the people that will work on papers with you, that kind of thing. And then, yeah, I think, I can't remember the other part of the question, but I'll leave it at that.
Dr. Brown, do you want to briefly respond to that?
Yeah, it kind of amplifies what Dr. Ray said. For me, I had a white colleague of mine pull me to the side one day, and she said, "Girl, stop defending yourself. Stop always, stop defending yourself." And I was like, okay, because she said, "You're good, you're a badass, you know what you're doing." And I'm like, but I'm not getting any traction. This is so difficult. So I valued what she said. I heard it come up here in my throat and I stopped, right? I learned to stop doing that, right? And I vowed to not defend myself, right? To ever be in a situation where I felt that I was being asked to defend. There's a very thin line between the kinds of inquiry that you find yourself being defensive versus this is a curious inquiry, right? But you know it, right? Curious inquiry is something very different and something very important when it happens. It's curiosity. You want to lean into it, but that defensiveness. So with that said, Dr. Ray, spot on about finding your people. I had to go outside of my institution, okay, and find my place and my space, return back to my ASBH race affinity group roots, and lean into this and not be afraid. This is for the early career scholars like myself. I am not tenured. I got gray hair, but like this is my second career. So we have to be brave. I think that's been a theme of today's conversation. And bravery is about asking. It is about looking through the ASBH, who's speaking well in advance, and saying, whose work have I read? Who do I want to meet? I want to know this person. It can be done. And people are very gracious, very, very gracious about meeting you for a coffee or breakfast or whatever. It's real. I can't stress it enough, but those are some of the things that I've had to learn. Don't be in a space exit when it's the defensiveness, lean into the curiosity, find your community, and stop defending yourself. You have a right to be here. You are here. It is critically important that we don't sabotage ourselves. Enough of the environment will try and do that for us.
Those are great responses. I'll jump in and then I'll turn it over to Dr. Dupree. So I'll just say the opposite of Keisha's experience. I went to a historically Black college. I went to Tuskegee. So I have many mentors. I have an entire village, and these people connected me with colleagues at Michigan State University and just really helped me to navigate throughout my career. But I'll highlight one bit of advice that one of my current mentors, Dr. Vince Bonham, highlighted, that he said, do meaningful work. When I was trying to figure out, am I a public health scientist? Am I an ethicist? Which box do I fall into? Not always feeling like I fit nicely into any sort of box. He said, just do meaningful work and people will recognize that work. Do good work, do meaningful work. So whatever you want to call it or label it, just make sure that you're passionate about it and make sure that it's quality work. So that's the first thing. And the second thing is a more recent mentor, Michelle Goodwin, really highlights the importance of controlling your own narrative. So tell people who you are career-wise, define yourself. So I am a health equity scholar that also engages in public health work and ethics. So it's about you defining. Now, whether or not you do that through a website or at conference presentations, when people are looking for someone, like, they need to know who you are, instead of allowing people to call you different types of scientists that you may or may not be, or to call you a community health worker when you may not even do community work. But there's a tendency for people to try to characterize the work of Black scholars because they don't fully understand it. So I'll just say, control your own narrative and tell people the type of work that you do. Dr. Dupree?
Yeah, I would definitely say everything that Keisha and Virginia said is true. I would, if I could do it all again, I guess I would not be so insular. In other words, I would not be trying to be this strong person, and I would share those times and incidences that have caused me internal hurt or turmoil or whatever, instead of keeping it to myself. I'll give you just a couple of examples. I had left my job in academia for a while, and I was doing hospice work in the community. I already had a PhD, had for years and everything. And so, as Black people will do, and maybe white people don't know this, Black people celebrate the community members who do well. And so I was visiting a patient, and they called me Dr. Vaughn. My middle name is Yvonne, everybody calls me Vaughn, so they called me Dr. Vaughn or Dr. Dupree. Well, the social worker went and reported to the organization that I was trying to confuse the patients and make them think that I was a physician. And I had not told them to call me Dr. Dupree. They did that because they were so proud, which they had actually stated as well, that, oh, we're so proud of you. Another incident that caused me inner turmoil was a colleague at the university who said to me, oh, you can get a job anywhere because you're Black. Again, I had a PhD, I had research, I had publications, but I will get a job because I'm Black. I didn't call anybody. I didn't talk to anybody about these things. And I think I could have let it go much, much quicker. Like if I had talked to Virginia and she said, girl, please, you know, these people are crazy. You know what you bring. And so I would say to youngsters coming in, share what is hurting you or what has hurt you so that you can just go on and remember your worth.
Thank you. And there was a question that came into the chat earlier.
Can I add something real quick? I've got to say this, Claretta. I got written up in one of my jobs I was in a space where there weren't many Black women, okay, in positions of white coatness, right? I wasn't a leader, but, I was in a space where, that coat went on a couple times. And an incident happened in the building. We had to evacuate, whatever. And my basic nature was, oh my God, look, how can I help? Because they were evacuating a unit and people were coming down the stairs. So I went against the traffic to say, can I help? I work on whatever floor I worked on. And this woman said, who are you? I said, my name, whatever. Long story short, the next day I was being summoned to the chief exec office because I was said to have presented myself as Dr. Brown. Okay, now that's super crazy, right? I'm not a physician. I wasn't a PhD. I wasn't a PhD candidate. I was just a student, but I was a Black woman who, I wasn't staff like this or staff like that. I just kind of maybe presented differently. It is a statement of respect, when you're in that kind of space. Dr. Virginia, my answer is speak that into being. Yes, I'm working on my doctorate. Thank you so much. But I recognized it. This woman, a young Black woman, was being punished for speaking to me. Her defense was, she said she was a doctor. She seemed to present as though she was a person in authority who knew something. And I'm being asked, why would I say that? And I'm like, but why would I? It's so easy to figure out that it's not true. So I haven't visited that moment for years until you said this. And it was tragic on many, many, many levels. It could have been career defining and career destroying had I not had what confidence was left in me. But then returning to my university, returning to Howard, and reminding myself I have a right to be here to do these things. And I just had to share that.
Thank you, Dr. Brown, for sharing that. And I'm just thankful for being in the space where we can just really bring ourselves to our work and our scholarship. It's just something that I think is really powerful, and I'm happy to be a part of it. So I will move on to the chat box. I'll start with Dr. Ray because there's a question addressed directly to her, and then one other person possibly to answer, and then we'll end with the question from Shika, who wants to be adopted by us. So the question is about images that really can highlight racial justice. I think there was the introduction of an image from Dr. Setterstrom that really looked at caregiving and allyship. So if there are any thoughts on images that we think we could use to promote justice or equity, what are your thoughts, Dr. Ray?
Yeah, this is something I think about a lot. Again, having a very different experience, going to predominantly white institutions, having all white mentors, something that I think about a lot because despite that, I've had, like I said, again, I've had great mentors and people who really helped me, and I would not be in my career without them. So, but one image that I hear often is people will say things like, will you walk through the fire with me, right? And to me, I think that that's an improper image. I think it's more like, will you follow me into the fire? Because we go into the fire ourselves. When we have to deal with racism, microaggressions, you feel the loneliness of it. You feel the heaviness of it. You feel the anxiety about, is this going to mess up my career? How do I defend myself? Like we've been talking about, how do I protect myself? You're going through it solo, no matter what. But allyship can be the people that follow you into these flames, right? They can be the ones that help you to think about it, to help you get resources, right? And so I really think about it as more of standing behind me in the flames, not walking with me, because I think that that's impossible to do for a white ally to do that with the Black bioethicist. So that's how I tend to think about it. But I know allyship is controversial. I know some people don't even like the term. it's a term that I accept as long as allies, again, know their place. Don't speak for me, give me the support to speak for myself, right? That kind of thing. And too many times we have people who think that we're voiceless, right? And we're not voiceless. We are, I think as this panel has shown, we have voices for ourselves. We're very strong, but that doesn't mean that you can't support me and give me the push or give me some comfort and to just protection to help me speak for myself. And don't think of us as voiceless.
Yeah, that's an excellent response. And if I can add to that, in terms of mentorship, and it's both mentorship and allyship, you've had white mentors. I've had also wonderful white mentors, but the part that's especially essential is not to tell people who you think they should be or what they should be doing. So you should be centering and asking questions. How can I help you to facilitate your goals? What is it that you are interested in? So really avoiding that paternalism and mentorship that is especially, I would say, pervasive with Black scholars that can really serve to handicap people in their careers. So I'll add that, and then I will move on in the last 3 minutes to Shika's question, and I'll start with Dr. Dupree. What are some ways that early career Black bioethicists can contribute to tangible change in the field without burning bridges? If you could do that in 30 seconds. I know that's easy.
Well, I think doing everything that you just said, doing your work, doing the work that is meaningful to you and with which you identify, and not letting people label that as Black work because it's coming from your melanated body. And just keep doing it, and then call us and we'll tell you to keep doing it. And I'm retired, no income, no financial disclosure. So I don't care, I'm not afraid of getting fired. So I'll say whatever.
Thank you, Dr. Dupree. Dr. Brown, do you have any thoughts on that?
I think from an ally, accomplice perspective, you don't have to have the language of injustice to call it out. You know that something is wrong. You know a comment was off center. You were left with an uncomfortable feeling. You do not have to define it any further than that to speak up and say, I'm sorry, excuse me. I don't really understand so-and-so, how this fits with this person's la-di-da. If you can address that discomfort, you don't gotta name it. You're not sure if it's privilege, whiteness, anti this, it doesn't matter. You have a moral center that does go off and says, well, that was weird. That was odd. I don't think I understand. Please explain more. I challenge you to that.
Yes, I think we had in the chat box earlier, Dr. Ray said, trust your gut.
Mm-hmm.
Yes. And again, as you're establishing in mentorship, I think these spaces are the spaces you're in the right places to meet other Black bioethicists doing this work. I mean, I met Keisha a year ago, and we've been able to establish, I met Virginia and Claretta years ago. So we're still meeting people. Our circle is constantly expanding, and this is one benefit of the virtual world and the pandemic. It brought all of us together to have these conversations, because when one person wasn't available, we were like, nope, you need to go to this person, or this is not my area of expertise. I do ethics and I'm Black, but I don't specifically focus on this. So you need to reach out to Virginia Brown or Keisha Ray or Patrick Smith. So we've continued to elevate each other. There's more than enough space, more than enough issues to go around, and we have to continue to work together, to lean into each other's work, to support and elevate. And we thank you for being here today. We've enjoyed this session. Thank you for listening to us. We've enjoyed sharing our stories and our lessons learned, and look out for future special reports and future lectures that center anti-racism and bioethics.
Thank you, everyone.
Thank you, everybody.
I'm going to the networking room. I'll get a table. Y'all can come and say hi.
Oh, cool.
Is there wine?
Where is it? Like, send the URL. I am so not together.
Thank you, Tasha. Tasha says, thank you, Black
Thank you,
Queen.
Tasha. Can we get these comments? These are like inspirational.
Yeah,
Yeah,
I do. Can we do like a word cloud? Could somebody do a word cloud of them? That would be like so wonderful.
That would be
I
good.
think when the recording is saved, so is the chat, I believe.
Yes,
Well,
that's
I'm
true.
saving the chat to my computer. So
That doesn't
Yeah.
save anymore.
yeah, mine is.
You got something special.
It says
That's
save.
what I told her the last time, because I don't
Yeah.
have save. I can't save either.
I can't save. Maybe you have a different version. My university version won't let me save.
I think, yeah, that's what I think. It's like some restrictions.
Yeah, built that they did at the institutional level.
I saved the chat, so I can send it around to everyone,
Yeah. I
make sure
did.
everyone has it.
Thank you,
all
Dave.
the
Appreciate it.
attendees. I wish I could have seen everybody who was attending.
Yeah.
Yeah, I know. But it's.
This was great. I appreciate it. I'm glad I finally got to meet you, Miss Coretta. I feel so deprived that I didn't have you
Oh my
sooner, but
gosh.
I'm gonna take it now. I'm gonna move forward and forget that and not be bitter about it.
Don't be bitter about it. All right. Bye, y'all.
All
Bye,
right,
everyone.
y'all.
Hey,
Bye.
Jenny. Thank you.
Thank
All right.
you.
I guess I need to go look at my ASBH handbook